First of all, we're going to hear from Robert, your Secretary General. It's always good fun to introduce Robert because there's so much material to work with. The last time I introduced him, I mentioned Coriolanus, Would You Have Me False to My Nature? But this time I thought of W.H. Auden, who wrote in memory of Sigmund Freud that he made us able to approach the future as a friend without a wardrobe of excuses. And I think today, 24 billion is 24 billion. And I know all these dreaded terms like activity and productivity and data collection can seem like a tyranny maybe if you're stuck in the system. But hopefully today we can learn more about data collection and that it can be our friend and not our enemy and slowly empty the wardrobe of excuses. So, Robert, thank you.
Well, thank you, Sarah, for that introduction. A bit of poetry early on in the morning is good, and good to see everybody. And welcome to Dublin Castle, and great to see so many colleagues here. I never really thought that activity-based funding was that popular, and that there's so many people engaged, which is great to see. Because as we'll discuss today, it's a key topic for us in terms of driving activity and performance across the system. So I'd like to thank my colleagues in Health for organising the conference and our colleagues in the HSE, and a particularly important shout out for Steve Mulvaney. I think Stephen is here. I don't see Steve, but I'm sure he's here for his leadership in this area, which is really critical. And we're associated with this conference because ultimately believe that we need to drive performance by linking funding decisions to performance, and also to using data in all its richness to understand performance and to use that data then to performance manage the system more effectively. And people know the context of where we've come from in the health system, where we are now and what the challenges are in the future. We've obviously seen a very significant increase in the budget over the last number of years, and people will be familiar with all the data in terms of the increase in spending and the increase in numbers. And this has been an unprecedented expansion in the inputs. And thankfully it has led to also significant increases in the output of the system across the board. And just some data I was looking at this morning. Since 2019, the number of outpatient appointments has gone up almost 20%, inpatient appointments gone up by 8%, day cases up by 13%, and emergency attendance is up by almost a quarter, 24%. So very significant increases in activity within the system, and we're seeing the impact of that in terms of reductions in trolleys, in terms of reductions in the length of time people are waiting, which was over 12.5 months for outpatient consultations at the end of COVID, down to 6 months now. So, and we're also seeing the improvement that activity is having in terms of life expectancy and people's satisfaction with their well-being in healthcare, which is ultimately the overall objective of what we're trying to achieve. And we've seen life expectancy in Ireland increase, and we've now jumped to the 7th highest life expectancy in the EU from 10 years ago. So they're pretty significant improvements to reflect lifestyle changes and people looking after the health more, but also the efficacy and efficiency of the system, which all of us here are a part of. But I think there are two trends to look to in the future in terms of what people in this room are mandated to manage these resources on behalf of the taxpayer. Two, I think, critical issues. Firstly is the ageing. Well, this is a very young audience. We're all ageing, it would seem, and quite dramatically. And we've been talking about this demographic bubble since I joined the civil service, which is sadly a few years ago now, and it's hitting us with significant force. And the steady state increase in demand for the system is probably around 3-4%. So if it's 4%, that means in 18 years the system doubles in size, and if it's 3%, it doubles in 24 years. So just give some sense of the scale of the demand, prospective demand increases that we're likely to see. And against that, we know that the phenomenal improvement in resourcing is not going to last, because we've gone through this golden period, and we do know that these periods, well, this is a particularly long expansion, it will not last. So we're likely to have a situation in the future where we've got the headwinds of resourcing not been as generous, and also very strong demand for the services we provide. So what does that mean for us from a policy perspective? I think it means two things. We need to focus much more on prevention, to keep people out of hospital, to enable people to empower themselves to look after their own health and well-being. And we're all familiar with all the great circulars from the Department of Health, which people take great notice of, about walking and obesity and diet and smoking and drinking and everything else, which we send out every week, it would seem. But anyway, these are all important, and we all know they're important in terms of giving people, empowering them to look after their own health. And I'm particularly interested, and just an aside, One of the initiatives we are looking at now is the whole question of calories on menus, which will be the next cultural war, or one of the next outings in the cultural war, if we introduce this policy and get some support for it and have a discussion about it. But in relation to prevention, there's prevention, and then, of course, there's a theme of this conference, which is around how do we use our resources to enhance productivity. And this is really the challenge that we face in the Department of Health and in the HSE. And while we have seen large increase in resources and we've seen increase in activity, we haven't delivered as much as perhaps we should have done with the improvement in the resource. So how do we close this productivity gap? How do we address this productivity gap? And that's been a real focus of the Productivity Task Force that Bernard and I share, and it's a real focus of ABF and what we're trying to do in terms of driving this initiative into the future. So we know from international studies across many different countries and over about 40 years that ABF can increase the transparency of service provision. It can reduce length of stay, increase discharges, reduce emissions, and ultimately introduce much more of a performance culture into our system. And to have activity linked to resourcing provides the correct incentives, both for those who are doing well, to do even better and to be resourced to do more things, and also to identify those sectors or those entities that aren't doing well, and they can be subject to performance improvement. And we're aware that these insights can be used to improve and optimise the system. So ABF is critical then ultimately for productivity, and it means that hospitals get paid based on the treatments they perform. And interesting, looking at the numbers and the scales, and I think Fiacre will talk about this later, that of our 24 billion spend across the system, about 7.1 billion, not too far off 30%, of the budget can be related to ABF. So if we can use these tools to improve the efficiency of that significant part of our budget, that can have a material impact upon the overall performance of the system. So we're looking at ways to improve productivity. The ABF system is one way in which we can encourage the hospital system to be much more efficient and to promote productivity. So in terms of what we need to do, and I guess this is the focus point of the conference, we've had this system in place, but now we need to improve it. And what does it mean for next year? And as Bernard mentioned, we've been doing this shadowing, this mirroring this year. But for next year, we need to move to more full implementation, and that means bringing down the transition adjustment and move more rapidly to a full implementation. And that really is, I guess, the key question for us: how quickly we can do this, how quickly can we use these tools now to drive forward the change that's needed. And ABF, we know, can generate productivity by generating the data that be used to improve performance. And I'm delighted to see that there are various sessions today, this afternoon, focusing on that. How can we use those structural examples across the system to how we can improve data to overall improve our performance? And a key aspect of this, of course, is to collect the correct data and to ensure that we have air codes and PPSN, and there's a special place in civil service hell for anybody who runs an organisation now who doesn't collect the PPSN. I think that's been well documented, and I still see it all the time, going into hospitals and seeing people given their details and not being asked for their air code or their PPSN, which is absolutely incredible at this stage of it. So that's really critical, and people in this room are absolutely key leaders in driving that change and ensuring that people understand the importance of having these codes so that we can link up all these lakes of data, and that linkage can really improve the significance of the data to enable us to improve performance. So I guess I'll conclude by saying this is a challenge, and this is a challenge not just for Bernard or for I or for Stephen Mulvaney, the senior leaders, but this is a challenge for everybody in this room. Like, what are you going to do to use the tools you have at your disposal, the data, your capacity and your position to drive the sort of change that's required in order for us to improve our performance? And ultimately, while this may be a dry subject, it has real impacts on people whom we serve, people who are waiting for procedures, people who are waiting too long to see a consultant, people who are today may be waiting on a trolley in an A&E waiting for a bed. If we can improve performance, that materially impacts on the well-being of our citizens and ultimately enables us to build or continue to build the type of health service that we all aspire to have. So on that note, good luck today. I'm really interested in hearing the policy conclusions, and working with everybody in terms of how we implement the next phase of this reform. Thank you very much.